Let's see, I'd like to thank Tina for being our volunteer. I haven't met her until today, but I thank you, Tina, for allowing me to needle you in front of all these people. So I thought we'd start off with a few questions. Tina, do you have any pain anywhere in your body?
Yes.
Would you mind telling us where?
I have bladder pain. I also suffer from migraines.
Okay, so bladder pain and migraines. Now, where on your head do you experience the headaches?
Usually to the right and down the side of my face.
Okay, so this is actually a gallbladder headache. Could I ask you to slip your shoes off and have a seat on the chair? So in all 50 states, acupuncturists are required to use disposable needles. One of the risks of acupuncture is the transmission of disease by using non-disposable and autoclave needles. And years ago, there was actually there was a transmission of hepatitis C, for example, in a patient, in an acupuncturist who was not properly sterilizing the needles in between. So early on, regulatory bodies said we must ask that all acupuncturists use disposable needles. So I like to tell people, make sure you see your acupuncturist opening up disposable needles. Now, the needles have a little insertion tube, and Tina, you're actually just going to feel the tube being pressed up against the skin. And if it hurts, please say ow. Okay, Tina, did you feel that?
Just a tiny prick.
A tiny prick, okay. So that was liver 3. It's a great heat clearing point. It's connected electrically and physiologically to the gallbladder. So let's take a gallbladder point on the lower leg. How's that?
Didn't feel it.
Didn't feel it. And then one more point. On the right arm, triple heater 5. Triple heater is related to the parasympathetic nervous system. So it's interesting, Dr. Proctor, that the sympathetic and parasympathetic nervous system are at play here. And this is a regulatory point for the parasympathetic nervous system, which has to do with the cholinergic and anticholinergic regulation of the body. So typically, in the clinic, Tina would be not sitting in a chair, rather lying on a comfortable bed. I typically would put in 7 to 11 needles. Most of them are going to be from the knee down and the elbow down, and maybe a few in the center of the body or on the head, depending on what's going on with the patient. And typically the needles are retained for anywhere from 20 to 40 minutes. If pain is more of an issue, we would actually do a little bit of a longer treatment. If fatigue and fibromyalgia and sleep disturbance is more of an issue, I may do a shorter treatment. Most people will feel relaxed during the treatment and won't feel too much else, although I've had reports of people feeling like they were floating. Some more creative artist types who have what we call big Huns in Chinese medicine will report all sorts of interesting sensations. And then other people like me, I feel nothing. So it just depends on, and I think there's something about that. You know, the creative types will be very descriptive. Probably Susan would have a elaborate description of how she experienced acupuncture. And someone like me who's a bit more analytic might go, mm-hmm. So if we were in the clinic, I would give Tina a doorbell to ring if she needed me, and then I would leave her to rest for about 30 minutes. So if you're okay, we'll just leave the needles in for a few minutes because I would like to get a phone call from you in a week and say that you haven't had a headache and that, you know, your pain is better. About 25%, okay, so just a couple housekeeping issues. Our clinic is in Sandy Springs on the north end of Atlanta. About 25% of your insurance companies are going to cover acupuncture. Medicare never covers it, nor does Medicaid. Insurance companies are more likely to cover it for pain than they are for some other condition. So I'll find out what pain diagnosis you have and list that as primary typically if you do have insurance coverage. Some insurance companies will say you have to have an MD do your acupuncture. Others will say you have to have an LAC do your acupuncture. So you want to ask this. And we had this happen recently. You know how insurance companies, is there anybody here from the insurance company? You know how insurance companies will frequently say they cover something and then in the end they don't? Have you had this happen? I have. I had one patient recently that said, oh yes, I have insurance coverage. So we did 6 or 8 treatments and then she called and she said they've denied every single claim because the only time they cover it is when it's done in place of anesthesia. Well, nobody here in the West does acupuncture in place of anesthesia. So that was a way for the insurance company to say they covered acupuncture and not have to pay anything out. And I think that's cheating. If you want to find a physician acupuncturist in your area, go to the website www.medicalacupuncture.org, and you can search by zip code or city. If you'd like to, and now there's about 5,000 acupuncturists in the United States, physician acupuncturists. If you'd like to find a licensed acupuncturist, and I believe there's about 50,000 licensed acupuncturists in the United States, go to www.nccaom.org. That stands for the National Certification Commission for Acupuncture and Oriental Medicine, nccaom.org. And again, you can search by zip code. Our website is www.metroacupuncture.com. If you have any questions afterwards, you can email me through that site or you can get the phone number off that site, and I'd be happy to take any questions in that way. So I'm going to take the needles out of Tina just so we can move the program on, and they're not likely to bleed even though they're several millimeters under the skin because they're so small, number one, and number two, remember they're pencil point, so they tend to not cut the tissue like a hypodermic needle will. Okay, so I'm stimulating the needle just a little bit. You tell me when you feel it. I'm really twisting and turning. And what do you feel? An achy, icky sensation?
Like an ache.
An ache. See, it really wasn't even a pinprick that she felt. And there's no bleeding. Now, tell me, Tina, when you feel it here. Yep, you got the achy, icky? Tell me when you do. See, so this is the sensation of da qi. 365 acupuncture points on the body, and the likelihood that I'm right on top of the needle is very low. So by stimulating the needle, by twisting it, or applying an herb in a technique called moxibustion, we actually call over the qi to that point and thereby manipulate it. And it feels kind of icky-achy, doesn't it? And it radiated away from the point, which is a good sign. So we'll take it out, no bleeding. And gallbladder 39, no bleeding. So let's give Tina a big round of applause.